Thanks, Brian. Um, a lot of terrific and timely information. Appreciate your feedback, and the whole data analytics things is a pretty big deal, and we're seeing more and more of that data kind of driving a lot of the thing that you're talking about value-based care. So having something I can just mention is having your data, make sure that you're having the right data, and make sure that you're uh, have something in place to ensure that you have the right data and that you're backing it up and all that other fun stuff. That's something that definitely you need to consider moving forward. I also wanted to mention something about that Brian was talking about, how technology is helping and making better decisions. We're seeing definitely an uptick in artificial intelligence and how that's being used as a method to drive some of these data and some of that data analytics in order to make those decisions. So help you make those decisions. So AI and data analytics and healthcare are coming together, and not at the pace that I think it can be, to be quite honest. But there's definitely some progress there. And I think value-based care is going to be a very important driver for that. So thank you, Brian, for really bringing that information in today's webinar. Before we begin the Q&A, I want to let you know how you can access the recordings of many of the webinars by going to our website. We have several of them there during that we did about 15 or 16 webinars during COVID that were COVID related, and not necessarily technology related, but anything and everything you can think of regarding COVID during some of the things that you need to do for your business. So visit the Medicus IT website, navigate the resources, and click on the Knowledge Center. That's where you'll have the copy of the recording. We will be putting that up shortly, and we also will be sending out a thank you email with the slide deck. We're in the midst of planning future programs. Keep an eye on our social media accounts and check your email for registration information about these programs. I will turn it over to Rob so that he can begin the Q&A session. Robert?
Thank you, Nelson. Excuse me, and thanks to Brian for a highly informative presentation. As Nelson mentioned, we're going to begin the Q&A. As a reminder, please submit any questions you have via the Q&A button on the bottom of your screen. Let's dive right in. Brian, how do you enroll in value-based care programs?
Thanks, Rob. Great question, because it's not that simple. So CMS has these set programs. I went into 3, but there are many more. There's a Kidney Care First program. There are different variations of ACOs. BPCI had, a predecessor, but then a couple of iterations as part of BPCIA. So you really have to be cognizant of when these programs are announced, because enrollment time is important. But wanted to, make sure to highlight that the government isn't the only entity that offers these programs. They're offered more and more through the private payers. It's not the easiest thing to get meetings with the private payers about these types of issues or these types of models. You really need to start capturing as much data as you can in the short term. Patient satisfaction, your own EHR, the metrics that you're able to capture. MIPS is a good start for those that are looking to get started. Once you have as much information as you can, that's when you can arrange these meetings and try to work out some models. For those of you who know Lily Brillstein, she's on our advisory board as well. She's done a lot of these programs, and we lean on her for a lot of this insight. But there's a lot that goes into it initially before you're able to get to the private payer programs as well. But with that said, there are a lot of medical home type models that the private payers offer. And if you're a single specialty group, if you have the size, there's a very good chance you're going to be able to enter into a value-based care program. What we would suggest is starting this program without risk at all, maybe even with per member per month payments, depending on the composition of your group, and make sure that you build it in over time so the program is of interest to the payers, because if you're not going to take any risk, it's of much less value. But there's a lot you can do, but you have to start tracking this stuff a little bit and following what models are gaining traction, and that's how you can get involved.
Thank you. Let's move on to the next question. Are hospital-based psychiatric clinics able to contract with a value-based program?
So that goes back to programs and being able to enroll in them. If it's hospital-based, meaning hospital-owned, then hospitals probably have better access to create behavioral health type of programs. This is maybe not answering the question perfectly, but telehealth has become a great way to, or I should say there's been a positive, I think, expansion of telehealth for behavioral health reasons. There's also technology has been able to assist in identifying some of these patients. But if you're talking about just your general patient population, you have to start with what is the total expense. Behavioral health related to social determinants of health can be a major issue if you're identifying certain, pre-existing conditions that drive ER visits, that drive other health issues. Then, yeah, there's a lot you can do on the behavioral health side, but it goes back to whose interest are you going to get, and then that goes all the way back to what data do you have to suggest that, number one, there's significant cost in your patient's care today, and how do you propose reducing that cost under the program? And then that's how you start to take those next steps.
Thank you. Let's try and get to a couple more questions before we conclude. Next question is, how do you get access to data if you're not in a value-based care program?
Yeah, all right. So I touched on this, I think, a bunch, but so EHRs, as poor as they are as interoperability, are helpful to pull data out of. So something to keep in mind, right? The more information you keep on your patients and the more that you coordinate care, just as a rule today, the easier it's going to be for you to collect data and then use that data to get into these programs or, use it to improve the overall care. For the more institutional attendees, there's also the CMS data that if you sign a data use agreement, I think it's $65,000 annually to have access to it. You have to state what you're going to use that information for, but if it is specific to the goal of these programs, improving care, improving patient experience, and lowering cost, and you can justify that, then you should be able to enter into these types of agreements. So there is data out there, but for most, I think the best value or the best data comes through the value-based care programs.
Okay, let's see if we can get to one more before we conclude. We belong to an IPA. It's the only one in our area. They would not allow us to review our contracts, and there is no transparency. We are suspecting that they have recouped our value-based incentives. Is there a way to get a report directly from the insurance companies concerning what our score is and how much we receive? Let me know if I need to repeat that.
I got it. So step one, review your contracts. I am an attorney, but I do not give specific legal advice. So keep that in mind. But step one is you have an agreement most likely with the IPA. Review that first. And then if there's just no guidance there, right, because somehow you got enrolled into some shared savings program, you should have the details on that to some extent. Even if they're not overly transparent, you should at least understand what program you're a part of and how that all works. And maybe it's as simple as signing up for the IPA. You're signing up to participate in value-based care programs. You may need to engage counsel on something like this to demand the results, but if you signed a deal that doesn't guarantee a fixed percentage of payments based on overall savings, so right, we made $1 million, and we as an IPA made the $1 million. If you didn't sign a contract saying you're going to be the beneficiary of that, you might have a little bit of a tougher case, but I would start with whatever documents are in place right now and start to work from there.
Thank you. This concludes the Q&A. For those of you who submitted questions that we did not get to, do not worry. They will be passed along to Brian along with your contact information. Before we conclude the program, I want to give our panelists an opportunity to share some final thoughts, beginning with Brian. Brian?
Thanks, Rob. Just more thank yous. Really appreciate everyone who helped put this on today. I don't know, hopefully people got some value out of this. I just know I've gotten a lot of value out of your previous webinars, so hopefully help break up the day a little bit. Hopefully people learned a little bit more about value-based care and at least have some more guidance on where to turn and what the future holds. I think value-based care is so important, and especially for independent physicians, because we're here to support you. And hopefully if you understand the rules enough, you'll start to realize that you can excel in these programs and thrive. So hopefully that's the takeaway. Thanks, Ron.
Terrific. Thank you, Brian. And I'm going to ask the mayor to rejoin us and share some final thoughts. Nelson?
Thank you. First and foremost, thanks again, Brian. I really appreciate your time and your expertise in this. For those of you who don't follow Brian on social media, I highly recommend that, especially on LinkedIn. He's always sharing some very valuable information, especially on value-based care. So make it a note to definitely follow him. With that, I would ask you to continue to follow us on social media as we continue to put some of these programs together. And the only way we can put these together, unfortunately, is because of the relationships we've built throughout the years with folks like Brian, whom we've been fortunate enough to leverage their expertise during these times. You know, healthcare has given so much back to Medicus and to myself that I wanted to ensure that I provided something back, and Medicus provided something back to the community, especially during these types of instances. And with that said, I hope everyone stays safe, preventive, strategic, deeply experienced. We are Medicus IT. Rob?
Thank you, Nelson. I want to thank Brian again for a terrific presentation and taking time to answer some of your great questions. I also want to thank Medicus IT for sponsoring the program, and of course, all of you for taking the time to join us today. As Nelson mentioned, please follow Medicus on Medicus IT on social media. We're on Twitter, LinkedIn, and Facebook for timely information during this national emergency, including information on the upcoming programs that Nelson mentioned. We hope that you'll join us for these webinars. With that, this concludes the program. I want to thank you all again for your participation. Have a great rest of your day, and please stay safe.